Hello everyone, my name is Lloyd Argonza, and today I'm going to perform bed bath returning demonstration. A bed bath means to wash someone in bed, and it is important because it cleans the skin and help the be from any infections. It helps to relax the patient, and it helps him to feel better. Before we do the prior procedure, we must first do the preparation or the procurement. So first is assess the skin condition of the patients, assess physical and emotional factors, presence of pain and need for adjunctive measures before bath, range of motion of joints, need for use of thin gloves during the bath, and any other aspects of health that might affect the client's bathing process. So next is to assemble equipment or the preparation of the equipment. So we have here water with the top temperature, bath blanket with 2 bath towel, deodorant, powder, soap, working gloves, towel, and pajamas, and also alcohol for us to avoid any possible contaminations and infections. And next is to determine the purpose and type of bath the client needs, self-care ability of the client, any movement or positioning precaution specific to the client, other care the client might be receiving, the client comfort level with being bathed by someone else, and necessary bath equipment and linens. Next is to determine the purpose and type bath the client needs, self-care ability to the client, any movement or positioning precautions specific to the client, and other care the client might be receiving, the client comfort level with being bathed by someone else, and necessary bath equipment and linens. So prior to the conduct of the procedure, we must do hand hygiene to avoid any possible contaminations and infections. Then identify the patient's identity and introduce myself to my patients and discuss the procedure with the patients and assist the patient's ability to assist with the procedure. So, good afternoon, sir, and today I am your student nurse. And is that okay with you, sir?
Yes.
So, can I hold your hand, sir? Please state your name, sir.
Daniel Rivera,
Your birthday, please.
August 23.
So today, we were going to perform bed bath, which means to remove the accumulated oil or dirt from your body, and for you to feel better or refresh. So is that okay with you, sir?
Yes.
Going to prepare the clients and the environment. So close the curtains around bed and close the door to the room and adjust the temperature to the room and provide adequate lighting for the patient privacy and comfort. Now I am going to don my gloves. So prepare the bed in the position of the client appropriately. Position the bed in a comfortable working height. Keep side rails up and assist the client to move towards you. Place a bath blanket over the top sheet. Ask the client to drop and hold the bath blanket while pulling the linen to the foot of the bed. So remove the top sheet from under the bath blanket, starting from the client's shoulder and moving the linen down towards the client feet. So note, if linen is to be reused, place it into the bed chair. If the linen is to be changed, place it into the linen hamper. So next is to remove the client's gown while keeping the client's covered with blanket, and then place the gown in the linen hamper. After removing the patient gown, I now have here a wash basin with warm water. It is about 2/3 full, which is at 43 to 46 degrees Celsius. But I'm going to have let the patient to check the temperature if it is tolerable for him. So, sir, can you please check the temperature if it is okay with you, sir?
Okay.
Next, we will gonna make bath mitt with the washcloth and wash the client eyes with water only and dry them well. Use a separate corner of the washcloth for each eye and then wipe the inner and the outer canthus of the patient. Then ask whether the client wants soap used on the face. Then wash, rinse, and dry the client face, ear, and neck. Then remove the towel under the head of the patient. So, sir, do you want to use soap to clean your eyes, face, nose, and your neck, sir?
No.
Next is wash the arm and hands. So place a towel lengthwise under arm away from you. Place and rinse elbow. Use long, firm stroke for wrist to shoulder, including the axillary area. And then place a towel on the bed and put a wash basin on it. Then place the client's hand in the basin, but it is for optional only. Then assist the clients as needed to wash, rinse, and dry the hands, paying particular attention to the spaces between the fingers. Then repeat for a head and arm nearest from you. So move your arms. expose your axilla. Same also with the left arm of the patient. Is wash chest and abdomen of the patient. So place bath towel lengthwise over chest, fold bath blanket down to the client's pubic area, and lift the bath towel off the chest and bath the chest and abdomen with your meat hand using long, firm stroke, or give special attention to the skin under the breast and any other skin folds, particularly if the client is overweight. Then replace the bath blanket when the areas have been dried. gonna wash the legs and the feet of the patient. So expose the legs further by folding the bath blanket toward the other leg, being careful to keep the perineum covered. And lift leg and place the bath towel lengthwise under leg. Wash, rinse, and dry using long, smooth, firm stroke from the ankle to the knee to the thigh of the patient. Then reverse the covering and repeat for the other leg. Then wash the feet by placing them in the basin of water and dry each foot. Pay particular attention to the spaces between the toes. If preferred, wash one foot after that leg before washing the other leg. Then obtain fresh, warm bath water now or when necessary. Then lower bed and raise the side rails when refilling the basin. Aim also to the left lower extremities of the patient. Wash the back and the perineum, then assist the client into a prone or a side lying position facing away from you. Then place the bath towel lengthwise along the back and buttocks while keeping the client covered with the blanket as much as possible. Then wash and dry the client's back, moving from the shoulders to the buttocks and upper thighs, paying attention to the gluteal folds. Then remove and discard glove if used. Next, wash the back and the perineum. Assist the client into the prone or side lying position, facing away from you. Then place the bath towel lengthwise along the back and buttocks while keeping the client covered with the blanket as much as possible. Then wash and dry the client's back, moving from the shoulders to the buttocks and upper thigh, paying attention to the gluteal folds. So can you move, sir, side? Next, remove gloves if used. Then perform a back massage now or after the completion of the bath. Then assist the client or the patient to supine position and determine whether the client can wash the perineal area independently. If the client cannot do so, drape the client and wash the area. Then assist the client grooming aids such as powder, lotion, or deodorant. Use powder sparingly. Release as a little as possible into the atmosphere. And help the client put on a clean gown or pajamas. So I'm done removing my gloves. Then ask the patient if he want a back massage. So sir, do you want to have a back massage? feel better and refreshed, sir?
Feel better and refreshed.
After doing all the procedures, clean all the equipment that we've used in the procedure, then perform hand hygiene. Then, document any possible observations or communications with the patient.